Hello everyone. Let's begin with the discussion of MCQ from the topic pharmacology, and also it includes comes under medicine. The question is: a 54-year-old woman complains about a burning pain in her chest, and she reports using NSAIDs drugs, non-steroidal anti-inflammatory drugs, for her constant knee pain. So, this drug impairs our gastric mucosal defense mechanism primarily by. Okay, this is a question. Option number 1: irritant effects on gastric mucosa, stimulating hydrochloric acid production. Option number 3: inhibiting nitric oxide synthesis. And fourth one is inhibiting prostaglandin synthesis. So this is the question. So here woman or female patient complains about burning pain in her chest, and also she has given history of using non-steroidal anti-inflammatory drugs for her constant knee pain. It could be due to she is using for her constant knee pain. Most probable or provisional diagnosis is osteoarthritis. To relieve the pain, she is using NSAIDs, okay, for constant knee pain. So now, because of this drug use, she is reported about severe burning pain in her chest. So what is the probable mechanism, or primarily, okay, the drug affects her gastric mucosal defense mechanism. Okay, so what is the important mechanism of this NSAID drugs produces this effect? So here non-steroidal anti-inflammatory drugs, they are, okay, inhibiting prostaglandin synthesis, okay, or inhibition of cyclooxygenase enzymes. It is the prominent mechanism by which it affects the gastric mucosal defense mechanism. Okay, but here you see, apart from these NSAIDs also inhibit nitric oxide synthesis, okay, and produces irritant effects on the gastric mucosa. There are other mechanisms. So the most prominent mechanism affecting the or altering the or impairing the gastric mucosal defense mechanism is inhibition of cyclooxygenase enzyme or inhibition of prostaglandin synthesis, because prostaglandins produces mucosal defense mechanisms. Okay, and what are the gastric mucosal defense mechanism here? So increases the nitric oxide synthesis, so release of nitric oxide, and it produces vasodilatation and improving the blood flow to the gastric mucosa. So increasing the blood flow to the gastric mucosa, so it produces important defense mechanism, proper blood supply to the gastric mucosa. Apart from that, some of the important factors like EGF, okay, epidermal growth factor, TGF, transforming growth factor, as well as fibroblast growth factors. These are the important, okay, factors are a proteins which are helpful for the regeneration of the epithelium, regeneration as well as restitution of the epithelium of the gastric mucosa. These are the important mucosal defense mechanisms. But NSAIDs are inhibiting the prostaglandin synthesis, okay, and produces burning pain in the chest. So this is a case of drug induced peptic ulcer or drug induced gastric mucosal impairment. So among these four options, most prominent factor is inhibiting prostaglandin synthesis or inhibition of cyclooxygenase enzyme. Option number 4 is the answer for this question. Okay, thank you all.